now invite Dr. Valerie Montgomery Rice, President and CEO of Morehouse School of Medicine, to the podium to introduce our speakers and to begin our program.
Thank you, Kathy. Good morning, fellow Rotarians and friends. It's such an honor to join you today to talk about something that touches every family, every neighborhood, and every corner of Georgia: women's health. When a woman thrives, a family thrives. When a mother is healthy, a community has the foundation to grow, learn, and contribute. Yet here in Georgia, too many women are not getting what they need, when they need it, in the amount they need to reach their optimal level of health. Georgia is a state of what I would describe as contrast. We have innovation and inequity living side by side. We are home to world-class hospitals, universities, yet we rank the worst in the nation for maternal mortality. Black women are more than twice as likely to die from pregnancy-related causes as white women. We have counties where there are no OBGYNs, no birthing centers, and no certified nurse midwives. Now, for some, these may be abstract numbers, but they're not. They represent real women, our daughters, our colleagues, our neighbors. And then when we look at cervical cancer, a disease that we can prevent, Georgia ranks are still among the highest in the country. And in 2025, that's really unacceptable. But here's the good news. We have the power. We have the power to change this story. We have the science. We have the partners, we have the proof that community-based solutions like Alabama's Operation Wipeout that we're here about, led by Rotary and academic partners, has shown us what's possible when civic organizations and health institutions come together with a purpose. And while Morehouse School of Medicine is not a part of that specific initiative yet, I am proud to highlight that for over 15 years, Morehouse School of Medicine and University of Alabama, Birmingham, and Tuskegee University have had a collaboration funded through the NIH focusing on reducing cancer disparities across the Deep South. We do this through our shared research, education, and community engagement. So today, guys, we're going to hear from two extraordinary leaders, Dr. Isabel Skowronski and Dr. Natalie Hernandez-Green, who are proving that progress is possible, one community at a time. Dr. Isabel Skowronski is a professor of medicine, vice chair for global and rural health, and senior advisor for Global Cancer University of Alabama at Birmingham. She's a nationally recognized expert in behavior science and cancer prevention, focusing on underserved populations. Her work in cervical cancer awareness and HPV prevention has resulted in impactful community-based interventions across Southeast, including Georgia. She brings a deep understanding, and I have seen it in action, to understanding the barriers to care and the strategies needed to overcome them. You're going to hear about today Operation Wipeout Initiative, which has positioned Alabama as the first state in the nation to develop a comprehensive plan to eliminate cervical cancer. Dr. Natalie Hernandez-Green is an associate professor in the Department of OBGYN at Morehouse School of Medicine. She also serves as the executive director for our Center for Maternal Health Equity. She is a leading voice for reproductive justice and maternal health equity. Her work focuses on eliminating racial and ethnic disparities in women's health, particularly among Black and Latino women in Georgia. She leads initiatives that integrate community engagement, policy, and research to improve outcomes for mothers across the state. Please join me in welcoming our panelists. Please come.
Good morning.
Morning.
Greetings from, I am at UAB, but today I am here to talk a lot about Rotary. I'm a member of the Rotary Club of Birmingham. So I want to start, as Kathy and Kevin asked me. My mom always said that the impossible takes a little longer. And I want to start with my personal story. I grew up in Brazil. This is not an Alabama accent. I had polio. I was 8 months old. I grew up in a small town. This is 1963. Now you know my age. And the vaccine would come once a month. And when I got the first dose, when the next dose came, I was sick. The pediatrician said, well, we will vaccinate her next month. And we had an epidemic. And I had polio in both arms and both legs. And like COVID, at the time, the hospitals would close the doors. So my mom needed to get on the train and leave me in a hospital in São Paulo. I recover both arms and one leg. The other leg still reminds me of how lucky I am that a lot of kids that I grew up with that had lung compromised didn't have the same luck. But that's the sad part of the story. I had a very strong mother who would put me in fashion shows and really put the disability out there. And she would go door to door, literally. That's how I grew up. She would dress me in shorts and would go with the cooler and say, you do not want this to happen to your child. But in a very positive way. I was the star in the region because, of course, we got 100% vaccination. And when I was about 12, she said, we'll get way more done if we split. And I knew the spiel, so I would dress in shorts and would say, this is what happened to me because I didn't have the vaccine. My brother would carry the cooler, and I have the speech. Yeah, today no child would carry the vaccine door to door. And that's how I grew up. So then, if you don't believe in God, here's a proof for you. And I joined Rotary in 1983. And then I was part of Rotary Club of Londrina in my hometown, and was a district representative, and came on a scholarship from the Brazilian government to Birmingham, Alabama. And where was the first chairman of the Polio Plus? Birmingham, Alabama. So this was but if you think about the Polio Plus, so I was in Rotary when we started. So I had started 2 years earlier. That again, God put me there for a reason. As Kathy alluded to, 85 we start Polio Plus. 88 we had the Global Eradication Initiative. We still had the 350,000 cases in the world in 88, to a little over 1,000 in 2008, 99% decrease, 64 cases in Pakistan and Afghanistan last year. So you're going to ask, was it the vaccine? Yes, but not really. Because if you think about the Salk vaccine became available in 55. 61, we had the Sabin. 74 was mandated by WHO that all the kids would be vaccinated, even in a small town in Brazil. It was not available at the time, but was available. And 14 years later, we still had 350,000 cases. And this is me, 1985. In Rotary. So was not the vaccine, because the vaccine was there. Who was in Calgary this year? The WHO Director General said that we Rotarians had the audacity to eliminate a disease and the tenacity to stay all these years until we finish. So it was really the Rotary and people like my mother that got the vaccine out there. And the last mile, the 64 cases are the hardest, and we cannot give up. I think now more than ever, we need to finish polio. In my club, we are starting on another mission, because we're gonna end. Our commitment, as you know, Rotary International, our commitment is until next year. So our goal is to really end polio by 2026. So we need to start the next mission, and that is wipe out cervical cancer in Alabama. What is wipe out? My club, we work in Sri Lanka, and we're very successful there as part of a global grant. And Sri Lanka will be the first low and middle income country to eliminate cervical cancer as an initiative from our club and the Rotary Club of Colombo and government. And a lot of the credit goes to the Rotary Club of Colombo. So one day, the Latin fact, I was very hot and I was in the board of my club and I said, I feel like an imposter. Here we are working in Sri Lanka when Alabama has one of the highest mortalities. And anyway, I had a little fit, and my club decided to embark on this and partner with UAB and many other partners. And then we brought providers and public health leaders from all over the state, especially rural counties, and said we need to put a plan together, and we did. But we said, well, if Rotary launches it, no teeth. If UAB launches it, no teeth. We need the state health officer to launch this plan and make us an official plan and a commitment of Alabama. And today we are the first and only state in the nation with a plan, and I hope Georgia will be next. And it's very simple. We need to vaccinate kids, because it's a cancer that is, the main cause is HPV, human papillomavirus, a sexually transmitted infection. We need to screen, and we need women to go to follow-up. We have all these tools in the U.S. They are free, either covered by insurance or federal programs. So we are today with cervical cancer where we were in 1985 when Rotary got polio. We had the vaccine. We just didn't know how to get that vaccine out there, and Rotary did it. So that's Alabama, and we have a plan. It's Operation Wipeout. You can go to our website, and I'll tell more about in the questions. Because I believe and I hope that I will see the end of another disease in my lifetime. And I can tell you the reward of seeing the end of a disease and knows that you play, I got emotional on this one. You saw the end of it and you play a small part in it. It's one of the most rewarding things that you're going to do as individuals and as a club. Because when I'm walking, and people, yeah, especially young people, ask me, what happened to your leg? And I say, I had polio. And I get, when they turn and say, what is polio? That's when I look up and I say, Mom, we did it. So let's do the same with cervical cancer.
Such a powerful, powerful, powerful story and message. Now, I went to Georgia Tech, but I know there's this football game between Georgia and Alabama. So we need to take on that same type of energy that we get concerned about when that game comes about, right? And we want Georgia to win. I know we can do this. I know we're not going to let Alabama beat us to being the first state to eradicate cervical cancer. So I know that is, we've already dropping the mic on that. I'm sorry. So
Challenge accepted.
That is challenge. So you joined Rotary through Rotary in Brazil, and you witnessed this transformation, and it was a transformation, down to 64 cases today in Afghanistan and Pakistan, and I know that all of us are watching this. Can you just briefly tell us what lessons did you learn from this experience that really shape your work in public health? Because I know what you do with us with cancer, but how did this really shape your work in public health?
Well, I think that my mom started training me in public health since, I started walking. I started walking a little later, but so I think that she was a math teacher and showed us the really power of the communities and how we can promote public health. So I think it's, to me, such a natural thing.
A lot of times people think that it's some big structure, but a lot of times it's going door to door, inviting other people to the table, asking them what's possible for them. And Dr. Hernandez, you have had a lot of experience with that in the work that you're doing in the Center for Maternal Health Equity. You give us a little flavor of what that center does. And just so that this community knows, that center was started from us advocating at the state level. And we received $500,000 from the legislators to launch that center. And now that center has how much funding annually?
26 million. Well, this year, 23 million.
That's a clap.
Yes.
I know some of you all are business people. 500,000 to 23 million over how many years?
4, because we were
4
started in
years.
2020.
Okay.
So yeah, during COVID. So funny story, Dr. Montgomery Rice, we get the funds appropriated, and it's around March. She's like, okay, you're interim director, because she wanted a physician to lead the center. I was like, I'm gonna get her. I'm gonna get her. I'm gonna show her that I can lead it too. I'm not the right type of doctor, but I have the skill set, and I have those lived experiences, right? I experienced postpartum depression for both of my pregnancies, and so this was something near and dear to my heart. But when she made me interim director, I think 3 days later, the whole world shut down. And I was like, how am I supposed to raise funds when I can't talk to people? I'm also an elementary school teacher, a preschool teacher, because I have 2 little kids. But, we persevered, right? And here we are, $26 million later, 4 years later, with impactful initiatives. We really follow what the Maternal Mortality Review Committee does or recommends for us to solve, because we were just tired of people talking about the issues. We needed solutions, and so we came up with them. One of them is getting people before pregnancy. We know that 30% of women of reproductive age in the state of Georgia do not have access to health care. And so we wanted to meet people where they're at. I'm a community organizer at heart. I've always been really passionate about community organizing. And I was like, why aren't we just meeting people where they're at? Why don't we train local people to give people the care, the resources that they need, in the amounts that they needed, in the ways that they needed? And so we developed a program called IMPACT, which is preconception counseling, which is an evidence-based intervention working across 4 different states. So our work is not just in Georgia, we're also national and globally. We just signed a contract with University of West Indies to expand our work in the Caribbean. And we have seen outcomes, and this preconception counseling was not just for women of reproductive age, but we knew that fathers and men needed to be involved. And so both are receiving these services, and we've seen incremental changes in knowledge, in readiness to change before people get pregnant. Another big flagship program that I'm really proud of, and something near and dear to my heart, is our perinatal community-based navigator program, where we train women from the communities who have power, right? Because we're not here to empower people. We're here to activate the power that people have by providing them the tools and the resources that they need. And so we train women with lived experiences as patient navigators, as doulas, as peer lactation consultants to provide social support for people from pregnancy through 1 year postpartum. And we have a clinical trial that's funded through the National Institutes of Health where we're testing the effectiveness of this program at Grady. But we also do it on the community side, where we work with FQHCs, we work with private clinician offices, we work at Morehouse Medicine, and other types of clinical providers, because we want to know if we scale this up and we do it right, then we can make changes. And we recently had a partnership with CARE, who provided tangible resources and brought in other partners to provide access to food, access to transportation, things that we take for granted, right? Because we are privileged to be in this room, but there are people that are suffering that don't know when they're gonna have their next meal. And so with those resources, we're able to provide it, and it's been a very powerful partnership with CARE and being able to deliver those resources. And lastly, Dr. Montgomery Rice mentioned rural and maternity care deserts. And so we're doing two things. We developed the third rural OBGYN residency program in the country. A small little HBCU like Morehouse School of Medicine did that, so applause. And now developing a research agenda where we're going into communities to listen to what people have to say and develop a research agenda that amplifies and centers people's voices, because again, we know that the solutions lie in the communities that we serve.
And that OBGYN training program is in Albany, Georgia.
It's in Albany, Georgia.
Because when we did our blueprint for Georgia, we found the highest rates of infant and maternal mortality there, substance abuse, and a lot of challenges, and of course the scarcity of OBGYNs. And I'm proud to say on Thursday, we signed the Memorandum of Understanding Agreement, affiliation agreement with Phoebe Putney Hospital to begin to develop our regional medical campus in Albany, Georgia. So it is really about connections. And so can you please tell us, Dr. Scalise, can you tell us about what it has taken for you in the community? What type of partnerships and connections have you had to make throughout the state in order to bring Operation Wipeout to life?
I think it's Rotary is at the heart of it. Since COVID, trust in the healthcare system has gone down. It has. And people don't trust vaccine. People don't trust screening. So what has really been impactful to us is especially Rotary clubs in small towns, where those are the leaders in the community. We are the leaders in the community, and they will trust the firefighter, or they will trust the leader in the textile business. They will go to their friends. So that's kind of we started. We went to Chambers County, that's border with Georgia, actually. It has the highest incidence of cervical cancer in Alabama, the same as in Guatemala or Nicaragua. And we engaged a local Rotary club there, 20 people. Their club's 20 people. And they identify a champion, a retired dentist who knew everybody, who lent us credibility. And he said, let's go and talk to the superintendent. In the back of my mind, I said, oh gosh, a superintendent will never go for this. You know, and talk about vaccine to the kids in the high schools. And this superintendent was amazing. He opened the schools, and this club, with our support, helped work with the high school students. They developed a campaign that is an amazing campaign for the county, the students. They got 81% vaccination in one of the high schools in a county where vaccination was 30%. So that is, to me, and because of the credibility of Rotary, we're able to engage the Alabama Department of Public Health. We're able to engage other organizations. And the beauty of it is there's no money on the table. We're just the catalyst. And when organizations come, they need to do what they want to do. If it's the school system, is the school system. Now, one of the things that we're about to do, we haven't started yet. Maybe it's another competition for you.
Let's go.
So is involve the business leaders in our club, because we have a club as a little larger than yours. A lot of the business leaders are in our club. And what we found is that we think of cervical cancer as a disease of the poor, the underserved. Well, we found that a lot of your employees do not go for screening or vaccination because they think that is part of their deductible. It is not part of their deductible. So it's ACA, it's federal guidelines. It doesn't cost them anything. Well, it will cost you some, because your increasing will go up, but I can show you that we have just organized the data that taking care of stage 1, 2, and 3, or 4 cervical cancer is going to cost us more. So just involving the business leaders to educate their HR, to educate their employees. So those are some examples of what people can do, and not having that pot of money that say, well, you have the money, you do it, has worked very well in Alabama.
So we know that we have the HPV vaccine that can help with cervical cancer. And for pregnancy, it's not that easy. I guess our vaccine would be birth control and choice, right? That would be for pregnancy. And so, Natalie, what are the things, though, that we can ensure that will decrease the chances of someone having maternal mortality or morbidity or during pregnancy? What are the couple of things that you know that we can actually change?
Yeah, I think what's amazing is that maternal mortality review committees found that 80% of severe maternal morbidity and maternal deaths are preventable. And that starts with giving people access to care, right? I think, again, Georgia has one of the highest rates of uninsurance in the country. And we need to ensure that people are covered and they're getting the care that they need. And it's not just access to care. The fundamentals of just being a human being, access to food, access to safe, affordable housing, being free from violence in our communities. Because for Black and brown women, some of the leading causes of maternal deaths is now homicide. And so we need to ensure that we have people in safe communities. In addition to that, the recommended screenings, making sure that people are attending their appointments, and particularly their postpartum appointments. Half of maternal deaths happen when we send a woman home to care for herself. Someone said, and I think it was a great analogy, is, a woman is like a candy wrapper, right? We love a woman when she's pregnant, right? And when we eat the candy, we toss the wrapper away, and that's what happens when we send women back home. We need paid maternal leave, right? Because often women, and particularly the women that we serve at Morehouse School of Medicine, are the underserved, have the highest rates of maternal mortality. Our rates in Southwest Atlanta are comparable to third world countries. And so there's a lot that we can do. We just need all of you to be a part of that journey with us. A quote that always sticks with me is, half of the world are women, the other half are their children. And every person is either a mother or a child of one. And so we all have a responsibility to create awareness. I think that there's been a lot of media coverage, but it always portrays it in a way where, a woman gets birth and she dies right on the table, when the deadliest time is when we're sending women home and leaving them without someone to support them. Using your platforms, all of you have incredible platforms. Use your platform to create awareness. Creating awareness is accountability. Once someone is aware of something, then they have to do something about it. And all of you have that power and privilege to be able to do that. Invest in organizations like the Center for Maternal Health Equity. We're doing amazing work. I can only talk to you for 2 minutes about the work that we're doing. We have a whole website. We have 10 active research projects. We've served 5,000 women in just 3 years. 5,000 in 3 years as an academic institution. No one else is doing that type of work. Engage with community-based organizations. We're at the heart of the reproductive rights movement here in Atlanta, Georgia, and the civil rights movement. Again, engage with those organizations, hear what they're doing, how can you be involved? and help shift the narrative. Equity isn't charity, it's justice, and the Rotary Club can help normalize what that looks like, whether it's through volunteering, mentoring, or convening leaders across the country. So I think those are things that we can do.
So I always like to think about what's next and the foundation of hope. I know for me, hope is a part of the public health strategy. And so one thing briefly that each of you hope for in the work that you're doing, please.
I want to see the end of cervical cancer like we're seeing with polio.
Okay,
That's all.
That's
Very,
it.
Very, very achievable goal.
right. Okay, Natalie?
I have hope that people will take action after this. Hope requires action, and I'm really excited about the opportunity to use this platform to engage all of you on why you should care about women's health. People say our communities are resilient, but resilience without justice is exhausting.
Yes. Okay, so I will end with this. Rotary helped eliminate polio, 99.9% reduction, guys. And as our speaker shared with us, that didn't happen just because we had the vaccine. We had to mobilize that vaccine. And nobody thought it was going to be easy. It was very, very hard, but it happened because every Rotarian saw that what was possible, and they refused to accept the status quo. If we take that same stance with maternal mortality and cervical cancer, we clearly can beat the state of Alabama, y'all. We can beat the state of Alabama. But what can you do? I'm going to leave you with 4 things. Just advocate, advocate, advocate. Implement opportunities at your work site. See what's possible. Have some difficult conversations. And if you're not comfortable as the leader having it, find someone in your organization that will have that difficult conversation. And make sure that you participate in grassroots efforts that allow people to lean in and bring their best self to the opportunity for change. I know that we can do this through Rotary. Let's make Georgia the first state in the nation to eliminate cervical cancer and end preventable maternal deaths. Because when history looks back at us, I want them to say that the Rotarians showed up again. Let's show up. Thank you very much.
So, clear demonstration of the power of Rotary. I invite any members who would like to ask a question to come to the mic.
Thanks so much for being here. I find that so few people are actually aware of the underrepresentation of women in clinical trials, the incredible challenge of funding for women's health, not to mention the fact that the vast majority, if you do a meta-analysis, if you extracted the data for women, things we know that are conclusions about health are actually really only conclusions about men's health. How do we, in a world where we have such divisiveness, and I think views on reproductive rights cause people to even segment within the women's community, how do we create a tent big enough to actually really address issues around women's health?
I can start. And so I think nationally we're there, but in Georgia, it's always been divisive, right? I think we've had to fight really hard. I think what's been effective is finding more in common. Every time I talk about the fact that half of the world is women and the other half are children, that's something that we can all agree on, and that's that starting point. And I think what's also been effective is really centering and amplifying voices and centering those stories, right? Particularly from people who feel invisible and giving them the platform to be able to tell their story. And people resonate with that, and then people want to know more. And I think providing us these platforms, like I'm 0.02% of Afro-Latina women who get a PhD in this country. And, you know, I always feel so lonely when I'm in a lot of these spaces. But I make sure, and I'm always grateful to people that sponsor me, like Dr. Montgomery Rice, like Isabel, like you, who've given me these opportunities to help lead in these spaces and have these hard, you know, difficult but meaningful conversations on where to go and have solutions lined up. You don't need to think about it. I already know what you can do these things, and I think that's been effective.
I think the other critical part about clinical trials is that we have to invite people many times to be in the clinical trial. So we have to raise awareness about the importance of the inclusion of diverse persons in those clinical trials. And I'm talking about even if I'm doing a trial that I'm just looking at gender, okay? We have to have that level of diversity because we know there are some things that are unique. So part of it is for us as providers and clinician scientists to ensure that we're inviting everyone to be in the clinical trial.
Yeah, and we've had published studies on that. We wrote a paper through the U54 that if you just ask someone to be a part of a clinical trial, they were more than likely say yes, but they're not being asked.
Well, thank you for all you do to help our community. I'm Bahazidan. I run a software company that we've been focused on the rural health. And I've been in rural health since the year 2000, so a long time. And I see the largest impact in rural health is policy-driven. If you think about Medicaid expansion, telehealth reimbursement, vaccination rumors, grant funding, are you allowed to help your patients, educate them around voting and getting involved in the policy making? Or do you do that?
We do. Us as me, I'm a state employee, so we cannot lobby, right? So we can only educate the community. But I think one of the things that I have found, at least in Alabama, that us as academic centers, we need to work very, very close with government. Because a lot of times we see us here and the government there. So for us, the Alabama Department of Public Health is phenomenal in terms of us feeding evidence base so they can advocate. It's on us as academic centers to feed scientific information to policymakers. You know, so that is the role of academic center. Now, Rotary, you can. I can't. I can do it behind the scenes. I can provide you with information. I can provide you with the evidence. But I don't know about Morehouse. Y'all are private, so I cannot lobby.
Yeah.
I mean, I think more importantly than lobbying is ensuring that we're educating and informed and having people to feel empowered to make their own decisions based on objective information. So always trying to give both sides of the story. Now, I will tell you, we have a long-standing public-private partnership with the state of Georgia, and when we went to advocate to the one of the committees to really get that $500,000 to start the Center for Maternal Health Equity, it was all about showing the data. We were showing the data, and we broke it down by counties, and we talked about what the access challenges were and what was the result of having delayed prenatal care. What was the result of not having a hospital or a birthing center when someone has an emergency? What is the result when someone has to drive 50 miles and they have an emergency and they're pregnant and they're bleeding? These are the real life stories that our mothers, sisters, daughters are living through. And we can prevent this. And so they started this partnership with us, and they've been along with us all the way.
All the way, yeah. And working with community-based organizations, I think what we've been instrumental, not just feeding the policymakers, because we have great relationships with policymakers, not just at the state level, but federally, but also they're the ones that can be out there lobbying and doing that grunt work, right? But we're also training them. And so we actually have a policy workshop next week with community-based organizations and our learners, because we know our med students, our PA students, and our nursing students are really instrumental in helping to achieve, you know, systems change. Because you're right, policy is the only way that we're gonna achieve that.
This is actually for Dr. Montgomery Rice, Valerie. If we could extend beyond maternal inequality and outcomes, I've always been fascinated by infant mortality and the great inequality within Georgia. Our infant mortality, I think, is like 8 per thousand, and Sweden, Switzerland, Singapore, theirs is 3. So I was thinking, what's wrong with Georgia? Turns out if you're, I believe, a white woman in Buckhead, it's 3, just like you're in Switzerland. But our state is so high because if you're a black woman in a rural area, for instance, you're not getting the care. Could you talk a little bit about how big the inequality is now, because I haven't kept up, but also what can be done with it? It seems like a lot of it is prenatal, it's nutrition for mothers, et cetera.
I mean, you hit on it, and one of the things that Dr. Hernandez-Green Center does is that they've captured these stories, guys, which are what we call near misses. I trained at Grady Hospital some time ago, and at that time we were doing 10,000 deliveries a year. I did 475 vaginal deliveries as an intern and 175 C-sections in my first year. Wow. So we were really, really busy, and many of those women did not have prenatal care. And so I saw the importance of prenatal care. But I also began to understand what cultural competence and humility looks like and what it feels like. And it feels like you got to listen to the story that the woman is telling you about her body and the changes that are happening so that you can meet her where she is, meet she and her family where they are, so that you can ensure that you are providing with them with the optimal level of care. Because we can do all of these things. I mean, we can provide access to care, we can provide prenatal care, we can have the most proficient providers, but if they are not proficient in listening and working and co-creating solutions for people when unique challenges come, we will still have untoward outcomes. So it is really about how we bring cultural humility and cultural competence by listening to the woman about what her preferences are, and how those preferences go well beyond choice, guys. It goes to adherence, whether or not people are going to be comfortable with all the recommendations that you are making. We have a ways to go here in Georgia, but we've started to catalog all of these stories, and it tells us, and we're learning, and we took that and created training sessions for providers so they could understand what happened when there was a near miss. And a near miss means the woman almost died, or almost had what we would call a level 3 morbidity, but somehow it was caught. It was a near miss. And so that woman got to tell her story about her engagement with the staff, her engagement with the provider, what she was saying for pain, and someone wasn't acknowledging. So when she ended up having an abruption or something, it could have been prevented if they had listened. Those are the type of things that we're capturing because that resonates with people. Because I always say behind every statistics is a person standing there with the tears wiped off. Okay? And so we need to remember that.
Next question. Thank you.
I'll make this quick. How do you reach out to the people? I heard the doctors and the clinics and all of that. As a nonprofit organization, which is totally not focused on anything necessarily medical, we focus on business owners. I've never been asked to distribute information, to share information about studies or anything else. And there are so many nonprofit organizations in the city that I think that could be an outreach that would serve you well and serve the community. And so you don't have to answer that now, but it was more of a statement. I just had to say that we're missing a good opportunity with our churches and those groups.
So we have those. We actually have our First Ladies initiative. We're working with the First Ladies of churches across the state. Next week, we're hosting them at Morehouse School of Medicine to talk about how the state can be involved. But we have over 100 partnerships with nonprofits throughout the state and the Southeast, where 56% of the African American population lives, because again, we go to where the data is. And so we've been able to establish these huge coalitions with nonprofits around not just maternal health, but women's health across the lifespan. And so I think that's the secret sauce. That's what makes our center very unique, is that we're definitely engaged in working with community and co-creating. I can't sit on this stage and say that the community didn't have a big part in developing the clinical trials or the other things that we have going on. So that's really critical and central to how we do our work, is involving our communities, particularly leaders like you in nonprofits.
You know where I am, Valerie.
Yeah.
Hey, quick, maybe first of all, way of helping us round out. Amazing. You three women are amazing. You're leading the charge not only for the Southeast, but the work that you're doing will ripple out around the world. I'm Michelle Nunn. I'm the president and CEO of CARE. Very lucky to have Valerie on our board. I just want to maybe two questions, and maybe it's also just a charge for us to reflect upon. One is the Rotary Clubs of America and around the world, but I would say America has had an important role in disseminating the understanding of the efficacy of vaccines over the last decades. America is now a source of undermining that sense of confidence that has emanated from the scientific research, not only here, but around the world. So any particular, given Rotary's extraordinary accomplishments and achievements here, any particular charge to the Rotary clubs here and around our country? And secondly, if we wanted to be in that friendly competition with Alabama, what would the first 2 or 3 things that we might do as a club or as individuals be to get Georgia to defeat cervical cancer? Thank you all.
Okay, so we started now with Rotary International, a group, because really my dream, and I'm working on it very hard, that Rotary International will pick cervical cancer as the next polio. So we do have now, what we have done is engage clubs around the world now. I can send the link. And actually, I'll be talking to the Rotary Club of Birmingham, England, this Saturday. So because that is with exactly that intent, that the leaders out of those 2 groups actually is a Rotarian from England and one from Scotland. And I said, we need, us as Americans need to play the background. And has been amazing. We have had 3 webinars and to engage other Rotarians. I was one of the keynotes in Calgary, and that's why now Wipeout is getting a lot of attention, because that's visibility for other clubs. The other thing that we have our club has been very intentional when we speak is be very apolitical. So it's about eliminate. It's the only cancer we can eliminate, the only one. So when I go to a Rotary Club, and it has happened, and I get the pushback about the vaccine, you say you can focus on screening. If we have a high cervical cancer incidence today, it's because of lack of screening, and it's not lack of vaccination. The vaccination will be another 10, 15 years. So I think that is how we can mobilize and really approach cervical cancer as a global problem that is not only a low middle income problem. We have it right here as one. Georgia is not too far behind us. I think you rank a little higher in a better way than Alabama. But I think that as much as we focus on the elimination and not I am from America, you are from Scotland, or you are from India. So I think that's one. The second, I think where we start, actually we have a navigation chart in our website for Rotary clubs. I think the first step is for you to identify a champion in your club. Who is gonna, you always need that point person. I mean, you are in Rotary, some of you for a long time, you know that you need a leader. And then engage, your state health officer that already spoke to him and he is interested. So then you get started. And we are available to provide any guidance in anything y'all need.
So we will take the challenge, and Dr. Valerie Montgomery Rice, if the president will allow me, will be the champion for our initiative here with the Rotary Club. because I know I can call on every other academic health center and every other entity, but we're going to beat Alabama. We're going to become the first state in this union to actually eliminate cervical cancer, and I know that we're going to have our colleagues here to help us move it forward.
All right, well, you heard the challenge. Isabel, Natalie, and Valerie, thank you very much for a wonderful program. All right, next week, October 27th, our program will be on MARTA, Metropolitan Atlanta Rapid Transit Authority. So the interim CEO and their chair of their board will be here with us. And then in November, I want to highlight two special programs. Because of the observance of Veterans Day, we have, on November the 3rd, we have the program with Arnold Panaro, CEO of the Panaro Group and retired United States Marine Corps Major General. And then on November the 10th, our program will feature 3 young service people from 3 branches of the armed forces to talk about their service and their experience. So hope you will join us. We are adjourned.